Good afternoon. Good afternoon. Welcome to my YouTube channel. My name is Robin McGrady, and thank you for joining. Today I want to discuss white coat hypertension, white coat high blood pressure, and white coat hypertension or high blood pressure is when your blood pressure is abnormally high when you go in to see a physician. The term white coat means that the white coat or the thought or the anxiety that is associated with a um, physician causes you to be anxious. And I found in my practice as a nurse, as a registered nurse, that this is um, predominantly seen in the Black and brown communities. I'm not saying other people of other ethnicities don't have this, but in my 30 years of experience in the community, I see it a lot in Black and brown communities. Now, let me just also say that anyone with a fear of going to the medical provider can have this white coat hypertension. And so it is not exclusively to Black and brown people. So I want to get into some of the causes, and I want to get into some of the things or the treatment modalities that you can do to get your clinician or provider to work better with you so that you can get the accurate measurements of your blood pressure. Because what we don't want to do is treat a blood pressure that is erroneous or skewed. And I like to tell the people in the community that one blood pressure reading, as my colleagues know out here, is not definitive of hypertension. You have to look at the setting, what happened prior 30 minutes, an hour to you getting there. For example, if I was late for an appointment and going to get my, let's just say, a physical or EKG or echo, anything, I'm late, I'm frustrated, I'm tired, and I don't really want to go to the doctor's office today. Like a lot of nurses don't. But hey, that's the way it is. So, what you have to do is, before you get to the office, maybe utilize technology. Shoot them a text, give them a phone call, and say, hey, I'm out here in the waiting area, but I'm taking a few minutes to relax. Now, if you're really in a hurry, then you can go to the office and ask the doctor to listen to your heart. Listening to your heart, he's going to start listening to the back first because he might want to listen to your lungs while he's there. This deep breathing for a few minutes, where you see the chest rising and falling, is going to allow for you to relax. I want to say that again. It's going to allow for you to relax. So that's one method. Now, we know that hypertension nowadays is defined with the top number, which we call systolic, over 126. I might be a little bit off on that, but it used to be different, but now they're lowering those numbers. The bottom number, they want to be about 80. Down in the description, I'm going to type out the norms for blood pressure readings and what your provider is looking for you to be around. Okay, so again, the numbers have changed because African Americans hypertension is this is the problem. When you're hypertensive and you're an African or Black or brown person, it affects the kidneys quicker or in a shorter period of time than it does our European brothers and sisters. Okay, so the young Black man that's hypertensive, is going to be more compromised, especially if he has other comorbidities. What are comorbidities, Miss McGrady? I'm glad you asked. Comorbidities or other problems is if you have high blood pressure, diabetes, and stress, and then when these jokers hold hands, well, then it creates a cascade of events worsening the chance or increasing the chance for kidney disease and other deleterious effects to the body. I didn't mean to go there. I want to stick to the white coat syndrome, come back to the point and say what you need to do. What you need to do, as I stated, is relax. Establish communication with your provider or utilize telehealth medicine. What is telehealth medicine? Telehealth medicine is when you can write down your numbers at home, purchase one of those little blood pressure devices, or if you know someone that can do it manually. If not, purchase the manual blood pressure device from your local pharmacy. Check your readings for a week or two. And then you could, and if you don't do that, you could write it down and bring it to your doctor and say, hey, this is my blood pressure at home. So we can get an average. We want to get a baseline of what your blood pressure is. For example, you can have episodic hypertension. In other words, it was an episode, you were upset, and your blood pressure shot up. This ain't the time to check your blood pressure if you just got through arguing, maybe running around the house, maybe preparing for a test. No, wait till the dust settles. I want to say that again. That's so pretty. That's helping me. Wait till the dust settles. Breathe. So again, let me go back over my 3 major points. White coat hypertension is when your blood pressure is elevated above the norm, which 120 over 60. If it's 140, that's mid-level. If it's 160, 180, the top number, that's really getting up there. And the bottom number, we like it to be under 80. Okay, so a lot of times if you go to the dentist or other places and it's elevated, they don't want to treat you because you're at risk for having problems. So again, the 3 interventions you can do for white coat syndrome hypertension is number 1, make that doctor's appointment. My battery is getting low. I got to get in and out. Communicate with your physicians. Your physicians say, hey, I don't like coming to the physician. Can you give me a chance to relax? Can we establish a rapport so that my outcomes are better? That way you can better serve me. I can better serve you. We all win. Please, thank you for tuning in. This is a real short video. I want you to hit that click and subscribe button. I want you to come back next week because I'm going to go back and talk about diabetes, more specifically gestational diabetes. I'm talking to my sisters out here that are pregnant, planning on get pregnant. Come back, watch to the end. Don't click off. I need you to watch to the end. I'm going to be talking about gestational diabetes. Big topic, very important. We can get this together, sisters. If y'all come on with me, we can change the numbers. Peace to the family, peace to the community. We in this together. I got mad love for y'all. Peace out.